Hey guys, your urologist told you you have a big prostate and it's the source of all your urinary symptoms. How does that work? Hey guys, Doc Heps here. So the question is, your urologist told you you have a big prostate and he thinks that's the source of your urinary symptoms. And you're wondering, how the heck does this work? Well, I'll go over what a prostate does, why it's there, what problems it can cause, and what potential treatment options there are to help with your urinary symptoms. Thanks for watching. So what is a prostate? A prostate is a sexual gland that produces fluid. It produces fluid that's in the ejaculate. That fluid helps the sperm to penetrate the egg. Basically, after you've had kids, then the prostate just can cause trouble. It can develop prostate cancer and it can enlarge. So prostate enlargement, BPH, benign prostatic enlargement. All men from their 40s on up will have a somewhat enlarged prostate for the most part. Most men's prostates will grow starting in their 4th decade to 5th decade of life, and it just progressively enlarges. And this is a normal process. There are things we can do to help reduce the development of symptoms. These include exercise, weight loss, staying healthy, but sometimes it's just a genetic factor. And many men will normally develop symptoms enlargement. We call these lower urinary tract symptoms. These include weak stream, poor flow, intermittency, which is starting and stopping of the urinary stream, hesitancy, which is you get up to go to pee and it just doesn't come out efficiently. It just takes a while to come out. Also, some men have a sense of incomplete empty. Oftentimes, men will also have some what's called irritative symptoms that include going frequently and urgently, but it's never normal to have burning, pain, or blood. So if you have this constellation of symptoms that are becoming bothersome, then you should see your primary care and your urologist. So as I mentioned, benign prostatic hyperplasia or hypertrophy is common. And why does this happen? We say it's from an enlarged prostate, and I just told you that's normal. Well, sometimes there can develop a mechanical obstruction. Let me show you in this diagram. What's happening on my left here is that this shows you a bladder, and then this is a prostate. The urine is stored in the bladder, and then the bladder muscle squeezes and pushes urine out into the urethra and the outside world. And this is through the prostatic urethra. As long as that is open, then you can have a good stream and good flow. But just next to this normal prostate is an enlarged prostate. So you can compare this normal prostate to the enlarged prostate. So what happens over time, the prostate grows and there's a mechanical obstruction or blockage to the flow of urine. And that manifests itself as all the lower urinary tract symptoms that I talked about. Weak stream, poor flow, intermittency, hesitancy, sensation of incomplete empty. So it's basically, as I mentioned, a plumbing issue that the bladder stores urine. It wants to push it out when it's full. If the channel is open, great, no problem. But when the channel becomes obstructed, then the bladder has difficulty pushing, and that can lead to bladder problems and other issues. So that's the mechanics of what's going on. Now, how do we treat this? Well, if the symptoms are not that bad, there's no infection, you're not having any issues, the kidney function is good, your bladder's emptying okay, and we'll assess this while you're in the office, then maybe we just watch. As long as the symptoms are not too bothersome, we might just leave it alone. The second level is medications. There's a few different medications that are out there that might help. The basics are Flomax or tamsulosin. It's basically a muscle relaxant for the prostate. It helps to open the prostate channel by relaxing the muscle cells that are within the prostate. There's also medicines that will shrink the prostate. These are called Avodart, Proscar. The generic names are finasteride and dutasteride. And these work over 3 to 6 months to reduce the prostate size by 30 to 50%. Oftentimes we use these medicines in combination. A third medicine called tadalafil or low-dose Cialis we use, and it can help with men's urinary symptoms. We don't really know why it works, but it can help with the urinary symptoms while avoiding some of the side effects that the other medicines cause. Now, if the medicines are effective, but you don't like the side effects, or the medicines are becoming ineffective and you're still having troubles, then the next step would be some sort of procedure. And there are minimally invasive procedures where the prostate tissue isn't really cut, but either vaporized or pulled apart. And then there's the traditional transurethral resection of the prostate or Roto-Rooter procedure, where we go into the prostate and we remove this internal tissue to create a nice open channel for the bladder to void and empty. Hopefully this gives you a good sense of why the prostate causes problems. It's basically a mechanical obstructive problem that the medicines are designed to help alleviate that mechanical obstruction. If those medicines don't work, then we as urologists can offer procedures to open that obstructive channel. This is Doc Heps. Thanks for watching. Subscribe to our channel. I appreciate your time. Thanks again.